All right, I want to turn to disease prevention because I've already told you this is real important, but then the question is, what is it? What do we mean by disease prevention? Here's the definition. Anticipatory action, so action taken in advance to reduce the possibility of an event or a condition occurring or developing, or to minimize the damage that may result from the event or condition if it does occur. That's a lot of blather, a lot of words. Let's see if we can make some sense out of it schematically here. Primary prevention is the column that I'm pointing to right here. That's the kind of prevention we in public health love. That's big-time public health. What is it doing? It's dealing with people who are susceptible to a disease problem but don't have the problem at all. So it's, say, going to kids who could get obese if they don't exercise and watch their diets, and it's intervening with them to make sure that they avoid becoming obese and having the health problems associated with it. Down the line, there will be a reduced incidence of disease as a consequence. We love primary prevention. Primary prevention is the core, the heart of public health. There's another piece of it that we do. Oh, I should mention probably the single most important example of that is immunizations. People who are getting immunized against diseases don't have the diseases. You give them the immunization, they don't get the disease. So you're preventing it from occurring in the first place. It's wonderful because there are no adverse consequences. Now, obviously, with immunizations, there are very occasional adverse consequences. All right, there's another area, though, that we like, too. We like this a lot. I don't like it as much as primary, but we like secondary, too. Secondary is good. Secondary is taking people who are asymptomatic, and it is doing something by way of an intervention, typically screening and treatment, that will end up reducing the prevalence or consequence of their asymptomatic problem. What's a good example of that? Sir? Breast cancer screening, absolutely. Good. Other examples here? Yeah. Diabetes is a very good one. High blood pressure, high cholesterol, obesity. There are all kinds of things that we can screen for and do something about. Even though there's a problem there, you can avoid the problem down the line. First time I ever went to give blood, I was a senior in college, and I was probably nervous. I didn't feel like it, but I came out of there and they said, "Oh, you've got borderline high blood pressure." Now it turns out both of my parents have had high blood pressure throughout their lives, and lo and behold, I started getting treated for it. Now, one thing you can do, of course, is you can intervene by telling people to lose weight, to exercise, get themselves in better shape, and maybe their blood pressure will drop without giving them medication. But if that doesn't work, the next line of defense is medication. And when that happens, we have very good evidence that that will reduce the prevalence of strokes, heart disease, and other things down the line. Now, tertiary prevention means you're symptomatic. You've got a problem and you know it. And what we're going to do is we're going to intervene to try to reduce the complications and disability from that condition. This is what we commonly do in medical care and what we commonly refer to as treatment. Disease condition, something symptomatic that you come into the doctor about, and they say, we're going to do X, Y, and Z, and try to reduce the problems associated with it. So from a technical point of view, we got primary, secondary, and tertiary, but in practice, public health is much more narrowly focused on primary and secondary. Tertiary is where we talk about services that are provided in the other health services. Yes, ma'am? STD treatment? Once again, this is interesting that so many of you are raising this. STD treatment would be something, it could be asymptomatic, it could be symptomatic. It depends. I mean, it depends where you are with the condition. If it's asymptomatic, you can get treated typically with an antibiotic and avoid the consequences of it. If it's already symptomatic, so something's happening to you, once again, treatment may be able to reduce the adverse consequences of it. Okay? What I thought was interesting when you mentioned STDs, that's another case of what we refer to as externalities, where a big part of the problem is not just you having it, but the fact that you're likely to spread the disease to others. And we'll be talking more about that later. Sir? The big difference between incidence and prevalence, and again, I think the EPID lecture will probably deal with this. Incidence are new cases that are occurring in a given period of time. Prevalence are the number of existing cases. So you can think of the prevalence of high blood pressure as the proportion of the population at any given time who have high blood pressure. The incidence would be the number of new cases during that period, like a year, that are identified. Okay? Very important distinction. It has a lot of effect on how you think about dealing with disease, by the way. Okay. Example of the different levels of prevention. I think these, I hope, will help to clarify this. Think about motor vehicle injuries. Primary, one of the best things we've ever done, and we've done lots in the automotive safety area that involves the structure of the roads. Putting in median dividers, so you divide the highways, has dramatically reduced the number of collisions. I don't know, I think I mentioned this earlier. Well, I'll ask, and if nobody knows, then either I didn't mention it or nobody was listening. What's the most dangerous driving condition? Did I mention this one? Pardon? No, I'm not thinking about texting, but assuming you're driving responsibly, you're awake, you're not drinking, you're not eating, you're not doing your eyelashes or whatever, okay? What's the most dangerous kind of roads to be driving on and in what conditions? Sir? Is it like unpaved residential? Nope. Pardon? Twisty roads in the rain might be pretty bad, yeah, depending, but there's a specific kind. You've done it, huh? You've been there? Specific kind of road, and what I'm thinking about, I guess I didn't mention it before, is two-lane roads, typically in non-urban areas, at dusk. So the sun is going down, it's going to be very bright in one direction, it may be a little difficult to see, and so on. You have cars coming at relatively advanced speeds with no divider between them. That's the most dangerous condition for driving cars. Divided highways got rid of that. That's primary prevention. Those collisions don't occur. We came up with them. And again, when you think about it, do you think about coming up with divided highways as public health? I don't think I ever would have thought of it that way originally. That's great public health. You're going to see some data on the reduction in automobile collision injuries that will blow you away. And it's terrific public health, and a lot of it has to do with the structure of the highways and the structure of the cars, and not much to do with the individuals inside of them. Secondary prevention, requiring safer cars. So airbags. Somebody's in a collision, so the event has occurred. The airbag is dramatically reducing their risk of serious injury, or in some cases of any consequential injury at all. Better driving practices like wearing seatbelts also does that. Tertiary is the emergency medical service system. We save a lot of lives after car collisions because we have systems to get to people quickly, where we can also provide them life-saving services on the spot. We don't have to get them to the hospital, which used to be the case. An ambulance used to be something you were thrown in and they would try and drive you to a hospital and hope they got you there fast enough. Now, emergency services vehicles will provide treatment on site, and you save many more lives as a consequence of it. All right, how about high blood pressure? Primary prevention is dietary education and exercise. If we all did what we should in those departments, we'd have a lot less high blood pressure. But we'd have some, and that gets to secondary. That's where you screen for high blood pressure and treat with medications. Tertiary, we treat for the diseases that occur. Strokes, heart disease, and so on. Any questions about the distinctions among primary, secondary, and tertiary? And I will say, a couple of you have given some good examples. It's not always unambiguously clear which label is best for one of these, but I hope you understand the general principles here. All right. I'm not going to spend a lot of time on this because I actually have 3 or 4 slides and don't want to take too much time with it. This is a very traditional model within epidemiology and public health. It's traditionally an infectious disease model. The notion that for a disease to occur, you have to have 3 things: an agent, a host, and an environment that supports it. That's kind of an important concept. It's not simply there's a bug out there. That bug has to have a host and an environment to make the disease come into being. So think of this with regard to malaria. The agent, etiologic agent, is Plasmodium. That's the bug. The host is human beings. And the environment includes mosquitoes, swamps, and the like that breed mosquitoes, where the mosquitoes pick up the Plasmodium and then deliver it to the human being. Okay? More recently, some people have started to adapt the idea of this triangle to behavior-related issues. These aren't infectious diseases in the traditional fashion, but they have a kind of communicability element to them. So in the case of tobacco, the agent is the tobacco product. The host is somebody who's a smoker or chewer. And there are incidental hosts who are involuntary smokers, people around smokers. And an environment where you have family, friends, culture, media, politics, etc., all encouraging smoking. And the vector in this case would be the tobacco product manufacturers. So this is just a way to think about something that's not strictly an infectious disease that has these same qualities. It requires these things to come together to have a disease problem.